So would you like to share your
Yeah,
personal experience
I
with
can.
us?
I can.
Yeah.
Yeah. So growing up, I had all these sinus infections. I remember just almost every month, every few weeks, I had another round of antibiotics because I had another sinus infection. And I remember just being habitual mouth breather and just having dry mouth and snoring at night and having all those things. And so that was kind of my life, just going to these doctors all the time. And I had enlarged tonsils and adenoids, which thankfully my mom did not allow the doctors to remove my tonsils, which was like a blessing that she, didn't let them do that. But it is something that a lot of people will have done because traditionally doctors are not trained to look at anything else, just like take things out. So that was the case. And then later on, I remember I was like first year in high school, I started getting these horrible headaches. I had a migraine every single day. I was dependent on pain medication. I could not function without, Tylenol twice a day, 3 times a day. And that was kind of my life for, the next 3 to 4 years. And then as like a young adult, I don't know, maybe 2021, I started having TMJ issues and my jaw started popping and clicking. I started noticing I had the clenching, the grinding, definitely was snoring and, doing all those things. And so when I started looking into later on, when I was already a speech pathologist and kind of got myself into this rabbit hole of myofunctional therapy with my own kids, I'm like, okay, check mark for me, check mark for me, check mark for me. And like, I have all these issues, right? And so then I started looking at, okay, what is the treatment now for adults? Because I was learning a lot about kids and how we can help kids through orthodontic expansion and, doing that in myofunctional therapy. But the general understanding is that once your face is done growing, which happens for girls around the age of 10 to 12, and then for boys, it's more like 8 to 10. Then your face is done growing. Like all the sutures around your face and your cranium are fused. When the face is done growing and all the sutures in your face and your cranium are fused, then traditionally the belief is that you can't do anything about it. So I started looking into adult treatment for myofunctional disorders and structural problems such as high narrow palate, underdeveloped jaws, and all that stuff. And I attend a lot of different conferences and trainings and stuff like that. So the topic of an appliance called MARPE came up, and MARPE stands for Mini Screw Assisted Rapid Paddle Expansion, which is a palatal expander that is implanted on the roof of your mouth with the use of little screws. And it's done, when you're awake. You don't have to be sedated for it, anything like that. Obviously, they give you anesthetics, and it's done in the orthodontist office. So you get that appliance and then you crank it. And then you crank it until the suture on your palate, which is, two bones that are fused together right in the middle, that splits. And so when that splits, you keep cranking it to whatever the orthodontist kind of measured you out to be able to get in relation to where your TMJ is positioned, right? So we don't want to kind of mess up your face. We want to make sure that we look at everything and see what we can do with what you have. So in my case, I started my palate at 26 millimeters, which is an average of a 2-year-old.
Wow. So like
Like that.
this. Okay.
Tiny,
Okay.
tiny. And in the course of my expansion, I gained another 13.5 millimeters.
Wow. So that's like, this. So
Yeah.
then it's more like an adult.
I'm
So,
closer to the average female adult.
so you used to have a baby's mouth.
Exactly.
Oh, wow.
100%.
Yeah.
So, but you have to know that the roof of your mouth is also the floor of your nose. So when we expand the palate, we also expand the nasal cavity. So that allows for that nasal breathing.
Makes sense.
That is not obstructed. That is, there is no resistance to it, right? So your body feels that it can control it and it can benefit from it, and there's no effort to it. A lot of people are mouth breathers because the nose is plugged, congested, there's deviated septum, there's enlarged turbinates, all these things that prevent you from kind of letting the air through freely, and therefore the body feels in that constant effort. And our human nature is to do the least amount of work, right? So we don't want to do a lot of work. So if nasal breathing feels like a lot of work, we're going to do the mouth breathing instead. Make sense?
Yes, absolutely.
Okay.
So, well, thank you, first of all, for sharing that. So now you know, from your personal experience, you know, how important it is to have this fix, because right now, do you feel any better compared to prior to the treatment?
100%. So my expansion right now is done, but I do still have the MARPE. It's in there because the space that was created, now we have to give it time. The body will fill it with bone, right? So there's going to be a new bone created to fill in that space. And therefore the MARPE kind of stays in there. And then also it allows to anchor the braces so that all my teeth can be shifted over. There's going to be some kind of cosmetic work after that to fix my dentition and stuff like that. But I really don't care about that. Is the benefits that I get from the expansion. So now I feel that I can breathe through my nose freely. I used to get also, I forgot to mention, I used to get nosebleeds like frequently. So I don't get those anymore. I can sleep, 6, 7 hours and I'm full of energy. I'm not dependent on caffeine. I don't feel like I'm going to fall asleep behind the wheel driving. I, have a lot of energy. I work a lot. So I feel like I don't have to be dependent on any like energy drinks or anything like that. Also, another thing that I've noticed when I work out and when I do cardio, breathing is so much easier for me. I don't feel like I have to open my mouth in order to like catch my breath. I can continue to nasal breathe even though when my heart rate goes up and my breathing is increased, like the rate of my breath is increased, I can still maintain nasal breathing. And there's so much more that we could go into when it comes to like benefits of nasal breathing when you're active, when you work out, how that improves your resilience and your athletic performance and like all those things. It all comes down to your ability to benefit from the air that you bring into your body. And the most benefit from the oxygen that we bring is going to be through nasal breathing. You don't get the same benefits when that air is brought in through your mouth.
Yep. So that's the reason why that you're so passionate about, what you do, because you experience it yourself, right? And then your mother and your children. So you went through that. So that's the reason why you would like to help not just adults, but children as well. That's why I love the reason that I enjoy these conversations because, and, enjoy us working together because I can see how passionate you are. And now because of your passion and because of your mission of helping other people, therefore you have been doing this for 14 years. Most people would be, okay, well, I'm good. I know enough. I have enough experience and I'm just do what I do. You always, go to continuous training and studying, right? So when people come to you, they have the most updated information and technology. You're saying that you're going somewhere, soon.
Yeah, so I have always been into continuing education and figuring out, okay, what else is there? What else am I missing? Especially after I started working with patients and being one-on-one. I have little Johnny or I have Mary and okay, she is having this issue. Okay, what else am I missing? How else can I help her? Right. So that was always my thing. But once I got into the myofunctional disorders, there's so many little kind of directions and pathway you can go, like it's all connected. So in order for me to have that holistic, comprehensive understanding of how mouth dysfunction affects a person on every level, I have to continue my education because I not only go to conferences that are for speech therapists, by speech therapists, but I go to conferences that are for dentists, orthodontists, body workers, PTs, OTs. I go and study from neurologists, nutritionists, GI doctors, ENTs, you name it, right? So there is a whole world, if you can imagine, of people that are super passionate about what I'm talking about today. and we all come together. For example, in January, we're going to Switzerland. So my team and I are going to a conference. It's called Tongue Time. And people from around the world are going to be there. And the topic obviously is going to be on tongue ties, lip ties, and all of that. But there's going to be also other things that are related, such as airway, sleep, and anything else related to mouth dysfunction. So I'm super, super excited because when we go to these conferences, people that are looking at these things on a daily basis and doing studies and research and working with patients and compiling all this evidence of how do we help these people. They're going to be there, right? And they're going to bring all the current and updated information of, how do we help this person with this and how do we help this person with that, and how maybe tweaking a protocol was more beneficial in this case. And so it's so super exciting for me to go and learn all these things from people all around the world. And we know that like Europe and countries outside of the United States are a little bit more curious, I would say, right? So they're going to have all this information that, had nobody in the United States have heard about it. So I'm like super excited to go there and bring that back home.
Mm-hmm. So now, like I've seen more children and adults, wearing braces, right? More now than probably 20 years ago. Now, would it be a good idea for them to come to see somebody like you before going to the orthodontist?
Yeah. So for sure. And another thing too is you want to make sure that the orthodontist that you go to see is somebody who looks at airway.
Mm.
And unless you go to somebody who talks about airway and does what's called a CBCT scan or an airway scan that fully evaluates like your whole facial structures and your airway, it's, unless they do that, that the orthodontist is not trained enough to understand why do you need braces and what to do about that. And so it is always a good idea to come and see somebody like me beforehand, so we can, obviously I'm not going to do an orthodontist work, but I can guide you and explain to you why certain things need to happen. What are the structural things that when you do go to the orthodontist you should be asking about? And people need to understand that you need to go and interview your doctor. You need to go and interview your provider. Ask them the questions, because you want to know that they have the education, the training, the expertise that you need. Don't just trust, the very first random person that you walk into their office and think that they're gonna solve all your problems, because there's a time and place for everything. And unfortunately, with kind of the outdated curriculum that we have for a lot of medical professions, including dentists and orthodontists, most orthodontists are not trained in this way. So, any orthodontic, kind of traditional orthodontic office you walk into, they're not going to look at anything other than how to fix your crooked teeth. And a lot of times, their treatment plan includes extractions, which is like the worst thing that you could do. When you remove teeth, that you automatically guarantee yourself a collapsed airway. So you're making your sleep and breathing problem worse at that point. So,
yep.
Yeah.
That's a good point. And I hope that you guys pay attention to that. That is important. I was intrigued by some of the things that you shared with me the other day. You said that when you change structure, you change function. When you change function, you change how you breathe, sleep, focus, heal, and live. I think that is very powerful. So now if people would like to get in touch with you, then how do they do that?
Sure. So my practice is called Advanced Therapy and Wellness Center, and we are located outside of Chicago in town Crest Hill, and our website is mytherapywellness.com. Our phone number is 815-782-4196. People can also find us and follow us on social media pages. We have Facebook, Instagram, and TikTok. We do post a lot of educational information there, so feel free to go and check out our social media pages. And if you have specific questions, feel free to message us through any of the social media outlets, but also you can email me directly at margaret@mytherapywellness.com.
Thank you so much, Margaret. I've learned a lot from you today, and thank you for spending time with us.
Thank you so much for having me.
You're welcome.